Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today we're going to move on with the neurological assessment of the patient. So we're going to discuss the two most important components of neurological assessment in this particular lecture, ranging from the motor examination, the sensory examination, as well as how to elicit reflexes in a particular patient. Starting off, we're going to discuss in detail the inspection of the muscles, that how are you going to detect any sort of tenderness, muscle fasciculations, as well as atrophy and hypertrophy is detected at this level of the examination. The involuntary movements are conducted in the patient, and you look for any abnormalities at rest during maintained posture, as well as with voluntary movements. The strength of the muscles is also looked for by performing the minor tests such as pronator drifts that is elicited. How do you perform this test, and what are the abnormalities that is going to be discussed over here? Then we're going to move on how you are going to grade the strength in a particular patient, ranging from 0 to 5, ranging from no movement to a full power in a coordinated patient. Then obviously the bare minimum technical disorders while you're carrying out the reflex examination. The major reflexes with the upper limb are the biceps reflex, and with the lower limb we have the patellar, as well as the reflex that is demonstrated at the Achilles tendon. So we'd be discussing the preliminary causes that result in an abnormality in these reflex activities over here, and how do you get to a differential diagnosis in these patients as well. Moreover, we'd be discussing the grading system over here regarding the reflex examination, ranging from 0 to a 4 with a patient in a clonus. The cutaneous reflexes are demonstrated as well, which basically includes the cremasteric reflexes, the abdominal reflexes, as well as we have a positive Babinski sign. How do we relate this sign with the upper motor neuron lesions is very important. That would be discussed quite briefly over here in this particular lecture. We'd be discussing the different important components of sensory examination, ranging from light, touch, pain, temperature, vibration, and joint sensations. Then obviously we'd be discussing the coordination examination that includes a finger-nose test, as well as a shin and heel test, which is performed to look for any abnormality with the imbalances as well as with the coordination of the patient. Gait examination basically includes the assessment of the gait or the walk of the individual that is going to be assessed by the physician, and any abnormality that is detected is going to be documented by the physician. Then on, we're going to look for any neurological diagnosis, whether it is in the spinal cord or in the root, which is evaluated by the back pain, tenderness, weakness, and loss of reflexes in the particular patient. So you can watch this lecture as well as a range of other medical lectures on our website. So do subscribe to our website, as well as you can start your free trial right now. Thank you for watching sqadia.com.